Greetings, everybody. Welcome to another episode of the TED in Your Head podcast. I'm Ted Moreno, certified hypnotherapist and high performance coach. And today I am very fortunate to have as my guest Dr. Dar Radfar. Dr. Rad, how you doing today?
Hey Ted, thank you for having me. I'm doing great. Excited to dive into talk about sleep, the most exciting thing that's going on right now, getting better sleep.
Absolutely. And I know a lot of people that are not getting good sleep. So hopefully they're tuning into our episode today. So I'm going to read a short little bio. Dr. Dar Radfar's passion for supporting people with insomnia and sleep apnea comes from his own battle. He treated himself with an oral appliance after he fell asleep while driving his car and crashed into a tree in 2009. This experience changed his life forever. Since then, he realizes his life mission by treating sleep apnea and insomnia for those suffering from these conditions. He's treated over 7,000 patients over the last 12 years. He is a board certified sleep apnea instructor and a diplomat and accredited member of the American Sleep and Breathing Academy. Dr. Radfar is a graduate of the USC School of Dentistry and is highly skilled in general and cosmetic dentistry. Now, I know there's a whole long list of accreditations and certifications. We won't go into that. What we're really interested in, Dr. Rad, I should say, is the accident with the tree. So could you tell us a little bit about that?
Yeah, so look, when I was 6 years old, I escaped my country through the mountains of Iran into Turkey on horseback,
Wow.
escaping religious persecution. And as I was on the horse, sitting behind a man that helped us escape, my family, my dad was with my brother, my 9-month-old brother, and my mom by herself on the horse. And he told me one thing: Dar, don't fall asleep. If you fall asleep, you're going to fall off the horse, you're going to fall off the mountain, and you're going to die. So that was my only duty at the time. I also was told not to, to look for snipers and all these other things that a 6-year-old should never be told. But I don't play victim to this story, Ted. I definitely use this story as motivation to live every day as it's my best, as leading it with as much hope and kindness and love and compassion as possible. Because when you're told at 6 years old, don't fall asleep, you kind of have this addiction to sleep. You kind of have this resignation and this quote unquote childhood trauma of mine that that sleep's really kind of something I got to be careful with. So I always kind of slept with one eye open throughout my life. And in 2009, many years later, almost 26 years later, I actually did fall asleep. I fell asleep at the wheel. I crashed my car about a block away from my home, going about 30 to 40 miles an hour into a tree. Luckily, Ted, it was into a tree, not into another human or another car. And I was feeling certain things. I was embarrassed, first of all, right? I fell asleep at the wheel. Like, I'm always on alert. How did this happen? But I was starting to feel a little tired throughout the day. My wife at the time when I was married was telling me that I started snoring. These are kind of red flags: tired throughout the day, snoring, my dry mouth when I would wake up because I was breathing through my mouth more, and all these things. Boom, get my accident. And then I got a sleep test. Luckily, they had home sleep testing back then, and they obviously still do now, because who has time to go to a lab and sleep overnight anywhere? So the home sleep test revealed, hey, you have mild sleep apnea. They gave me that mask that I couldn't wear called the CPAP machine. And it's not very sexy, not very fun. And a few months, I gave it back to them. I couldn't wear it, and I knew there was a problem. But few months later, I ended up seeing that there's an oral appliance, a mouthpiece that came out that got approved by the American Medical Association for dentists to make. So it took me a few weeks to make one, and put it in first night, slept great. I wasn't snoring. And boom, after that, I've helped over 3,000 patients with just an appliance, let alone hundreds and thousands of patients with CPAP machines, because there are some patients that really truly need to be on CPAP because their conditions are more severe. But majority of patients can be treated with oral appliance therapy.
Well, that is quite a mouthful and quite a story for sure. And thank you for sharing that. So, as a hypnotherapist, I work with people that have insomnia, and a lot of them are struggling with sleep apnea. they're having problems wearing the CPAP machine. They've tried other things. A lot of people come to me because they want to get more comfortable with the CPAP machine, or they want to avoid getting one of those and hoping that hypnotherapy will help them sleep more comfortably, which oftentimes it does, but doesn't always. So let's talk about sleep apnea. I'm sure everybody's heard the term, but maybe people don't really know a whole lot about it. What is it, Dr. Rad, and what are the symptoms of sleep apnea?
Yeah, so sleep apnea is when you don't get enough oxygen when you're sleeping. And it could not necessarily be a complete stoppage of breathing. It could be a reduction of breathing by at least 50%. So it could be this snoring kind of breathing where you're not getting a full breath. And as we know in yoga and meditation and breathing techniques, you inhale through your nose, take a deep breath, and exhale through the mouth, right? And if you can't take deep breaths, your oxygen saturation goes down. Your pulse ox, if you were wearing one, which the home sleep studies have attached to it, dips. And the more oxygen dips, the more your heart has to go, uh-oh, we got to beat faster to get oxygen to Ted's brain. He's suffocating. And so the heart overworks. There's less nitric oxide being produced. So you get constriction of your arteries. So one of the tail signs is high blood pressure.
Mm,
That doesn't mean you have to have high blood pressure to have sleep apnea, but
yeah.
eventually it leads to high blood pressure. And of course, your heart racing to get oxygen to your brain, then slowing down, and then racing, and then your bed partner elbows you to move around, and then you get oxygen again. That makes you a little bit more tired throughout the day because you're almost doing this mini marathon. So one of the tail signs of sleep apnea is feeling tired throughout the day, not feeling like you got enough rest. And people say, oh, well, that's because I got young kids or I got so much on my mind. And how do you really know unless you actually record and have yourself recorded through a sleep study? So if there's daytime sleepiness, if there's snoring, if there's conditions such as high blood pressure, acid reflux, because when we gasp for air and turn over and whatnot, the acid comes up from pushing from the diaphragm through the stomach. And so there's more acid reflux for patients throughout the day. They wake up with phlegm in the morning. There's headaches in the morning that you have. There's teeth grinding patterns
Mm.
that show that you're struggling for air. You're almost doing your own jaw CPR movement in the middle of the night, and the teeth kind of, if I were to choke you out, Ted, you wouldn't just be flaccid. You'd get aggressive. Your fight or
Yeah.
flight response triggers. And so teeth grinding is another indication. So we have so many red flags as an adult that I just mentioned that if you have any of these that show up, you can ask your dentist, you can ask your physician to set you up for a home sleep study. And it's typically covered by medical insurance, depending on deductibles, of course, and knowledge is power. And then once you're diagnosed by a board-certified sleep physician, you can then have the treatment modalities depending on how many times you stop breathing or have a shortness of breath that affected your heart rate and your oxygen saturation.
Okay, so that's one of the things I wanted to talk to you about is I didn't know there was a home sleep test. I understood that you had to go and do a sleep study and do a polysom
Polysomnograph, yeah, yeah.
right, okay, but I guess you don't really need to go in and do that. You there's home tests that you can take, and where would you get those? Do those need to be prescribed or
Yes, yeah, a
okay,
dentist that's trained in sleep apnea, such as myself, I do that even through telemedicine or through phone consults.
okay,
But also, most physicians, sleep physicians, if an internal medicine doctor doesn't do it, they'll refer you to a sleep physician called a
okay.
pulmonologist. They will refer you for that home sleep study.
Oh, because I think that stops a lot of people from getting diagnoses. They don't want to go spend the night in some room in some hospital someplace.
Yeah, if you have issues like sleepwalking or
Hmm.
restless leg syndrome, and that's the only thing that's really affecting you, you do have to go sleep into a lab.
Oh,
The home sleep study is specifically to show if there's sleep apnea or obstruction of any sort of, when you sleep, any air obstruction. That is measured very easily and actually more accurately, some studies show, because you're in your bed, you have the same room temperature that you usually
sure.
have, your pillow, the bed partner. You know, when you go to a new place, we all know we don't necessarily get the best sleep at a hotel room, let alone a lab with a bunch of monitors on you. And
Right.
they're like, "Go ahead, Ted, fall asleep now." Oh, okay. It's a challenging thing, and really most lab sleep studies won't even be covered unless you have a home sleep study first
Oh.
through insurance purposes. But it's so easy to do nowadays that you can ask your physician or your dentist if they're trained in the treatment of sleep apnea.
Very good to know. So let me ask you this. Why? Why do people have sleep apnea? What are some of the causes or some of the reasons why somebody might have sleep apnea?
About 75% of patients who have sleep apnea, it's due to having too much restriction around their neck, considered it's obesity epidemic and all these things that can cause us to kind of have that fat deposit in our neck that restricts the airway. The other 25%, it has nothing to do with weight. It has to do with
Hmm.
the anatomy of the jaw. So if the jaw is a little further retruded or further back because orthodontically it wasn't corrected, the tongue is therefore that's attached to your lower jaw also further back. As the tongue goes further back, it can relax and hit the back of the throat, called the soft palate. When the tongue hits the back of the throat and gets a suction against the back of the throat as we sleep, I know that sounds kind of crazy. That's sleep apnea. That's you
Right.
stopping breathing. If it vibrates against the back of the throat, that's called snoring. So the
Right.
further the jaw back is further back, the more likelihood someone has sleep apnea. Also, if they've had teeth removed to create room for their teeth, they're made their jaw more narrow, and now the tongue doesn't have somewhere to fall or sit,
Mm-hmm.
so it falls back even more, and
Mm-hmm.
therefore can cause sleep apnea issues. So there's a lot of jaw relationship here that can influence and increase the chances of a patient having or a human having sleep apnea. Now, Ted, I look at the kids now, right? So, and we can dive into that conversation of ADHD issues and teeth grinding and all this, but really, I look at kids between the ages of 6 and 12 years old, and I try to see if their jaw is wide enough to have not only the teeth come in, but maybe we could do some preliminary orthodontics to have these kids get their retruded jaw corrected with an appliance, or get their jaws expanded with an appliance so that as they grow up, they have more room for the tongue and there's more distance between the tongue and the back of the throat. So there's ways of seeing these things and helping these patients as a child so it can help lower their risk factor of having snoring and sleep apnea issues as an adult.
Okay, so that explains why, as a dentist, you're deeply involved in sleep apnea because there is some work maybe to be done on teeth or maybe even some anatomical restructuring of the jaw, that kind of thing. All
Yeah.
right. Okay.
And also, as a dentist, we can treat it. We are next to the CPAP machine, the mouthpiece that helps reposition. Actually, it
Hmm.
brings your lower jaw. It's called a mandibular advancement device. So when you put the mouthpiece in, it brings the jaw slightly forward and keeps it forward, doesn't allow it to fall back, especially when we fall asleep on our back. And we could
Hmm.
go over some sleep hygiene things. Don't fall asleep on your back. Gravity pulls the
Right.
lower jaw further back, the tongue further back, and again, have more apnea issues. It's better to sleep on your stomach or on your side if you can. But the appliance is something that as dentists we can treat, let alone we can do different types of appliances on children or
Hmm.
young adults to be able to get more room for that tongue so it doesn't fall back and cause apnea.
And the oral appliance that you're talking about, that is something that's customized. And again, that's prescribed by somebody like yourself.
Correct. Yeah,
Okay.
and in a majority of patients, I would say close to 80% of patients are candidates for an oral appliance. If you're very severe, you stop breathing more than 30 times an hour on that home sleep study, that's once every 2 minutes or more. It's best that you try the CPAP machine first,
Okay.
because you can only move the jaw so much forward with an appliance and get that airway open. Some people just have so much restriction because the tongue genetically is too wide and too big. The soft palate genetically is also too droopy and too saggy, so that they need air to be blown down their throat to separate that tongue from the soft palate. But typically, 80% of patients can be candidates for oral appliance therapy once the home sleep study reveals their score.
Okay, all right, got it. So we can easily understand the impact that sleep apnea has on a person's, physiology, right? High blood pressure, fatigue, brain fog, accidents because they're falling asleep at the wheel, those kind of things, right? Less quality of life because you just don't feel good, right? So can we talk a little bit about the psychological impacts of sleep apnea on a person?
Yeah, so we were talking about that fight or flight response when you don't get enough oxygen, and that builds cortisol, it builds stress hormones, and you get that
Mm,
anxiety, right? And so that anxiety can linger throughout the day. And so it's estimated that up to 32% of patients who have anxiety throughout the day is as a result of sleep disordered breathing issues at night. And so we're trying to do meditation and yoga, and we are more anxious when we are dealt with a problem. And look, Ted, as you know, in your life, in your business, you're dealt with a lot of people with anxiety and depression. Another, it impacts serotonin production. Everything gets rejuvenated while
mm,
we sleep when we get into deep sleep. And deep sleep, you get into if you don't have shortness of breath or apneic events that puts you back into light sleep. It almost your body keeps waking you up very gently, which doesn't allow you to fall into that deep sleep, which causes you to feel more tired. But lack of deep sleep, lack of serotonin production can increase depression. And so I have tons of patients that have like, hey, doc, ever since you gave me this mouthpiece, I'm not as grumpy in the morning.
yeah,
I
right.
actually feel happy,
Yeah,
like,
sure.
and guess what? They get off of their medications like Prozac,
Mm,
and other types of anti-anxiety medications that they may be taking, like Xanax. So I reverse engineer. When I see in the medical history someone taking blood pressure medication or they're taking anti-anxiety medication or depression medication, I always say, hey, how well do you sleep at night? And they usually tell me very poorly. All of a sudden,
hmm.
we do a home sleep study and they get a CPAP or an oral appliance, and they have a overall feeling of their mental health being a little bit more under control. And the impact that has, Ted, on your family, being more patient, being more kind and
Yeah,
compassionate. Try being more kind and compassionate and loving when you slept like crap the night before.
yeah, very
Let's be
difficult.
real, right? No matter how much we meditate, no matter how much we have a positive mindset, if we're chemically and hormonally are not rested and not sleeping well, good luck. You can't trick the mind too well until you have that apnea kind of figured out, and then boom, no apnea, home sleep test says you're good. Okay, now we can work on the other stuff through meditation and through mindset. And I definitely am a big believer in personal development, as you and I have discussed in the past. I think it's important for every human. I wish it could be taught in high school.
Absolutely.
For as a building block of how to be able to meditate, how to be able to focus on your breath. And breath and breathing is just as important, obviously, at night as we know it as during the day.
Yeah. So what you just said is really profound because I'm not sure a lot of people connect, um, you know, they may think that they sleep well, but they may not be sleeping well. And, they just snore at night when they sleep. But the idea that they may have sleep apnea that's, making them depressed or anxious or having that kind of fight flight response during the day, I don't think a lot of people really get that. So what you just said, I think, could be very meaningful for many, many people. So we talked about treatment options as far as dental treatment, and we talked about a mouth appliance. We talked about a CPAP machine, right? But people with less severe sleep apnea, are there things that they could do if they want to totally avoid, let's say, any kind of jaw realignment or dental work, or they want to avoid CPAP, or maybe even a dental appliance. I mean, and their sleep apnea is not that severe. Are there things they can do? I would imagine losing weight would be one of the most important things.
Yeah, losing weight is one of the things that we said that three quarters of apnea patients out
Hmm.
there are because of weight. But the problem is, Ted, you can't. It's harder to lose weight when you're not getting into deep sleep. There's a hormone
Right.
All right, it's called leptin. If you and I could
Hmm.
bottle leptin, we'd be multi-billionaires. And leptin is produced in deep sleep. What leptin does is when you wake up, it's in your bloodstream. It helps curb your cravings for really fattening, sugary, carb kinds of foods. It's very challenging when you sleep poorly to have salad the next day. You know, you kind
Mm.
of want pizza, you want something because your body's depleted. It wasn't really resting, so it needs fat, sugar, carb induced kinds of cravings that goes up. So leptin production not only helps reduce your cravings, but also increases your metabolism at rest. So being able to breathe better at night helps you actually lose weight. And even the mildest form of apnea, if you can't lose weight or at least prop up your pillow a little bit so you don't fall asleep there are these things that you can even put. They're called bumper belts. You can buy them on Amazon. It's basically a little contraption that when you wear it, it doesn't let you fall asleep on your back. So you stay on your side so the tongue doesn't fall back. So those kinds of things can help. But ultimately, mild patients, they do it a few times an hour. The oral appliance has been the best to help those patients not only protect their teeth, but open up their airway. There is an ingredient called N-acetylcysteine, NAC. NAC is a supplement that became very popular during COVID. Some of you listeners may have wanted to do the natural things such as D3, zinc, vitamin C. NAC was also recommended, NAC. And if you Google NAC and sleep apnea, the first thing that comes up is a National Institute of Health.gov study that shows a reduction of apnea by 30% with just NAC alone.
Hmm.
And that's how I incorporated that into my sleep supplement called RAD-ZZZ. One of the ingredients in there, along with magnesium glycinate and L-theanine, is NAC. And it's been shown that it could improve the mildest even forms of apnea, so that maybe you don't have to be reliant. But anything that you do, you should have a sleep study follow-up or monitor your sleep to see if it's working, because you don't ever want to think that it's working just because you're not as tired. Maybe your numbers can go down, but a home sleep study post-op, as I call it, with any sort of device or thing that you do can be done to see its efficacy.
Hmm. And I know that you can get RadZZZ on Amazon.com, right?
Yeah, you can do it on Amazon. You can do it on the website.
Okay.
It's available in different platforms.
Okay. All right. Awesome. Awesome. So, this is really, really incredible information. So I kind of have a, conversational knowledge of sleep apnea because of the clients that I work with, but this is really doing a deep dive. And I think this is so instructive and helpful. How can people get in touch with you if they maybe want to have a consultation with you, or maybe go see you in person? I mean, how can they get in touch with you?
Yeah, I'm based out in Ventura County. My offices are in Thousand Oaks and
Hmm.
Oxnard, 805dentistry.com. The 805 is our area code. So 805dentistry.com. You can message me through the chat there. You can also email me. Darradfar@gmail.com is my email. And you find me on social media on Instagram, Dr. Rad Health. I answer to all my DMs. I'd love to help. You don't necessarily have to come in for a consult. We can do it over the phone. I could refer you for a home sleep study, and then knowledge is power wherever you are in the world. I can direct you. I've taught over 3,500 dentists worldwide on how to do this. I could direct you to a dentist for an oral appliance. I could direct you to a physician in your area for the CPAP machine. And again, most medical insurances are covering these home sleep studies. So the company that sends it out to you will go over your medical insurance, let you know if there's any copay, send you the equipment. You do it in the comfort of your home, really easy to wear on your hand. Do it for a couple nights for accuracy purposes. Send it back to the company. I'll go over the results within a week and direct you towards the type of treatment. It could save your life. It could save your relationships. If you have a bed partner that, gets annoyed and sleeps in the other room, called sleep divorce. We want to get you out of sleep divorce, baby, right? And more importantly, gives you that energy and that mindset for your work, for your family, for your loved ones, to go to the gym. Just in general, being a happier. We got one shot at this right now, as far as we know, and a third of our life is spent sleeping. And we do so many other things to try to make the other two-thirds of our life good. But you can't make that two-thirds really, really, really powerful if that one-third isn't at its elite level. And because your health is everything. You guys are all trying to we're all trying to get better, weight, better finances, better relationships. Once someone gives you a heart issue or a cancer diagnosis, and it could be as a result of sleep apnea, everything else is at a standstill.
Yes.
So sleep is related to cancer. It's related to heart attack and stroke and diabetes now and mental issues like we discussed. So it really behooves us, if you have these red flags of tired throughout the day, snoring, or any of these medical conditions already, grinding of your teeth, dry mouth when you wake up in the morning, reach out to me or to your physician. Let's get you
Mm.
tested. Let's get you treated.
Okay. Well, Dr. Rad, you've come a long way from when you were riding that horse through the narrow canyons of the Mideast. So, thank you so much for all this good information. I have one more question for you, and I know that we just recently met through the force of nature, known as Denise WJ, and she spoke very highly of you. And so, I want to ask you, how do you remain centered and balanced while being obviously a very busy and very involved person? What do you do for your own self-care?
Yeah, I've been to a ton of retreats. I've been to Tony Robbins, Peter Crone events, the Kabbalah One Center,
Hmm.
Dr. Joe Dispenza. I've seen a couple times. Some of you may know these names. And
Hmm.
really, at the end of the day, all of them have come to understanding that through therapy, I've had therapy before many times to understand my limiting beliefs, my traumas that I've gone through, and all my mindset and how I can get it right. And through it all, I've noticed that meditation has been my biggest thing that I've done. And I do not only a 5 minute meditation on just focusing on my breath. And I notice after 3 seconds, my brain is scattered and I come back to my breath. And then I can go 10 seconds and then come back to my breath. The longer we can focus on inhalation, exhalation, the longer we can stay at peace and come to center whenever the world throws us so many things to handle. That's number one. The visualization meditation that Dispenza has taught me,
Hmm.
I literally closed my eyes, and after doing some cerebral spinal fluid breaths deep into my pineal gland, I became super relaxed. I visualized myself in a movie theater, a pitch black movie theater, and the movie theater comes on, the movie comes on, and it's the life of that is going to be my life in the future. And I visualize things that are happening in love, in wealth, in family life, and then I attach an emotion to that. The emotion could be gratitude and abundance and love and freedom and confidence, all those emotions that are attached to my visualizations. And I could tell you that, and Denise would be a person that would definitely say, wow, Dr. Rad, Dar, you've definitely gotten a lot of things given to you. And it's because of that thought, that intent that I spend 20 minutes a day meditating. I highly recommend anyone that is interested in achieving the best in their life to start meditating and having those visualizations and those emotions attached to those visualizations.
Yeah, that is really awesome. And of course, that's one of the things I do with my clients is, make the unknown known. Get the subconscious mind familiar and comfortable with what you want through visualization. In hypnosis is very powerful, but you don't need to go to a hypnotherapist to do what you've described. You have the brain power and all the equipment necessary to create a future that is exciting and compelling and fulfilling. So thank you so much for sharing those incredible things. Joe Dispenza is somebody that I'm always reading about. I've never seen him in person, but I think I'm going to put that on my bucket list to go attend one of his events. I hear they're really, really awesome.
Yeah, it's incredible. The more we show up, Ted, the more
Mhm.
we work on ourselves by going to these retreats, listening to podcasts such as yourselves, and doing some books, reading the books, doing the work. The more ultimately, as I say, when we take our last breath, we can rest in peace.
Awesome. Well, on that note, thank you so much for taking the time to meet with me. And so 805dentistry.com is how to get in touch with Dr. Rad. Of course, everybody knows they can go to tedmoreno.com to get in touch with me. I offer a free or I should say complimentary half-hour phone consultation if you want to talk about hypnotherapy and see if it's right for you. And maybe you have some sleep issues you want to address, and both of us are here to help you. So thank you everybody for tuning in. Thanks so much, Dr. Rad. Everybody take care and we'll talk soon. Bye
Thank you,
now.
Ted.